Drama on Capitol Hill today. Republicans unable to find enough support for the Obamacare repeal bill, and Speaker Paul Ryan forced to pull it from the vote. President Trump and Speaker Ryan just moments ago commenting. Let's take a listen.
But I'll tell you what's going to come out of it is a better bill. I really believe a better bill. Because there were things in this bill I didn't particularly love. And I think it's a better bill. You know, both parties can get together and do real health care. That's the best thing. Obamacare was rammed down everyone's throat, 100% Democrat. And I think having bipartisan would be a big, big improvement.
Obamacare is the law of the land. It's going to remain the law of the land until it's replaced. We did not have quite the votes to replace this law. And so, yeah, we're going to be living with Obamacare for the foreseeable future.
Joining me now, John Hart, Phil Kerpen, and Dr. John Goodman. Hey, Phil, let me start with you. A lot of drama, obviously a lot of arm twisting that came up short. Where do you see it all? How do you think it played out behind the scenes, and where do you see it going from here?
Well, I think it came down
I'm sorry, Phil. Let's start with Phil.
Okay. I think it came down to the Freedom Caucus making some final demands that they thought would be enough to deliver their whole caucus. I think they were able to deliver a significant part of their caucus on that final manager's amendment, but there were still some holdouts, and then they had the opposite problem on the other side. You started to have moderates abandon the bill because they weren't comfortable with those last-minute changes, and it just never quite got to the finish line.
You know, there is no official count. Of course, Paul Ryan and President Trump saying it was close, but guesstimating on the street, from what I understand down in Washington, is that the hardliners were still around 15 no's, but the moderates, it went up to 10 no's, and then you still had a smattering of the Republicans up to perhaps 8 that weren't convinced. So Dr. Goodman, having said that, you just heard President Trump speaking, talking about perhaps a bipartisan solution. Listen, does it have to completely crash at this point? Does the American public have to completely reject it again? Because for some reason, it's actually become a lot more popular recently.
Well, I think there was a huge mismatch between what Paul Ryan wanted to do and what most Republican voters want. Paul Ryan cut $1 trillion of spending out of Obamacare, and he used that money to cut taxes. But that's not what Republican voters were mainly asking for. Those taxes were taxes on insurance companies, drug companies, and those companies weren't even asking for the money back. But that's what Ryan wanted to do, and I think the typical Republican voter never heard that before.
You know what's interesting about that theory is that it's apparent that the more established Republicans are looking ahead to tax cuts and tax reform, thinking they would get something of a running start by getting a few cuts here and then applying it later on to scoring of the tax cuts. And that's why everyone said Obamacare had to come first. But obviously at this point, John Hart, we know that that's not necessarily true. Nevertheless, you know what, there should be some major falling out from all of this, shouldn't there?
Well, you know, I hope not. But Paul Ryan made a comment today. He said, look, doing big things is hard. These are growing pains with governing. And I think he deserves some grace. But, you know, the truth is doing big things is hard enough with people who want to get to yes, but it's almost impossible with people who don't want to get to yes. And so the bigger question is...
What does that mean, though? You mean that there was a recalcitrance among certain Republicans, no matter what? It was an animosity towards Ryan that superseded their perhaps what they were telling us, that essentially they were voting their conscience.
Well, I don't know what the motivation was, but I think some of the opposition, the arguments were incoherent. You know, there was an element of groups that in the past pushed for a strategy to, quote, defund Obamacare when Obama was president. That was ludicrous. A lot of the same groups were behind some of the opposition to this bill. It was not perfect. There were a lot of things in this bill that could have been better. But this was a big missed opportunity. So I think going ahead, we have to think about, you know, as Phil talked about in the opening, is it's almost a balloon effect in a negotiation, that when one faction demands certain things, you lose people on the other side. And there was not enough willingness to compromise. And, you know, it's really a deeper philosophical question for Republicans is, are we going to be the party of constitutional conservatism that embraces the American Revolution, or are we going to embrace the French Revolution, where we purge the least pure person among us all the time? Well, and that's the real challenge we face.
Yeah, but here's the thing, though, Phil, and I heard that, you know, listen, all day today and yesterday, some folks suggesting that the Tea Party and the Freedom Caucus was some sort of antiquated, you know, back in the days thing, you know, with muskets, and they were no longer needed, and they were overplaying their hands. But yeah, this bill had a lot of problems, and there was still a de facto mandate, and there was still a de facto subsidy, and premiums were still going to go up, Phil.
Yeah, look, I think if this bill had passed, it probably would have approximately stabilized premiums. We probably have had a low single-digit increase for next year. We're probably going to have a double-digit increase next year instead because it didn't pass. But what people really want is they want to see premiums going down. They've doubled approximately in the 4 years since Obamacare has been in effect on average. People were expecting a repeal bill that would knock them down 30, 40, 50%. And when the best Republicans could offer is, well, we're going to stabilize them, they're going to go up maybe low single digits instead, that was pretty hard for a lot of people to get excited about. And that was really the big push behind the Mark Meadows amendment and the Freedom Caucus to say, look, let's go after the core insurance market regulation so we can knock premiums down a lot. If the Senate can't go for that procedurally or politically, at least we'll be able to say that we tried it on the House side, and that's what he was trying to accomplish. He couldn't get it in the bill because the House wouldn't bear it. And, you know, I think at the end of the day, it would have been much smarter for him and other proponents of that amendment to vote yes on this bill, because what they wanted as a House amendment still could have been offered as an amendment in the Senate, where a lot of people have the same concerns that they do. And we would have seen whether the Senate could bear that or not. And so I think I share that concern about knocking premiums down. I think that's a very important objective, and to go after those core insurance market regulations I think is a good idea. But I don't understand how killing the bill advances that purpose versus moving it ahead and taking a run at that in the Senate. And I think that's where I part ways with some of the people who voted no.
Dr. Goodman, you know, to hear Paul Ryan talk about how tough it is to be in charge, it's kind of scary. You wanted the job. You lobbied for the, well, he didn't maybe want to be Speaker, but he certainly wanted to be down in Washington, D.C. And they all ran for this job, and they had like a 7-year running start at this. And so that part, I think, does not engender a whole lot of confidence among a lot of people. And of course, there's finger-pointing going around, but it does lead some people to wonder if he's the man for the job. Is this time to say, if we go back to the drawing board, should more parties be involved, maybe even new leadership on this one?
Well, in 7 years, there was no attempt to bring people together, no attempt at consensus. They went behind closed doors. They trotted out a plan that was going to take health insurance away from 14 million people. Nobody ever told Republican voters anything like that was going to happen. It was the opposite of what Donald Trump promised. So no wonder it didn't pass.
Well, the CBO 14 million is not a real number.
Well, it's going to be millions of people who lose their health insurance if you take $1 trillion out of the system. You can be sure of that.